What is your overall opinion of the bill, and would you take any specific action in regards to the bill if you were elected senator?
The bill horrifies me. The implications of it are so disastrous to all of us. That bill, in essence, is taking away our lives, it's taking away our liberty, and it's taking away a whole lot of money. It's totally absurd. And the only thing that I see relative to that needs to be done, it needs to be repealed. It needs to be repealed very, very quickly.
Yeah.
Sure, I'd repeal it. I wouldn't vote for any bill that was 3,000 pages. Realize that there's 9 pages of regulations that the bureaucrats are going to write for every page in that bill. It's a disaster. I would like to see doctors allowed to take 110% of every dollar they give to their indigent patients off the taxes they would pay. So we just encourage the doctors and the hospitals and corporations that give to doctor and hospital funds to support the charitable needs of our patients directly. Get the government out of it.
H.R. 3590 marks the first time, the only time in U.S. history when Congress has had the audacity to tell us we have to buy something that we might not want to buy. This is no empty command. If we don't buy it, we'll be fined and we'll eventually be imprisoned. This is wrong. They don't have the power to do that. I will fight every single day I serve you as your U.S. Senator to get this monstrosity repealed. It is patently unconstitutional and should never have even crossed the threshold into what could have been considered by Congress.
Healthcare costs are something that have to be controlled in order to get our debt under control. If we don't reduce our costs, then our debt continues to spiral out of control. So what we need to do, I don't like the insurance mandate. As a Democrat, I don't think that that's a good idea. However, it is an issue that we have to keep looking at year after year after year until we get it right. So next year, as Senator, I would make the bill better, but I would make sure that we have controlled our health care costs.
Clearly, I would vote to repeal it because I did everything I could to kill it while it was moving, voted against it at every possible opportunity. But this is a time for me to remind everybody who gets excited when someone says, I will repeal it. Politics is a team sport, and you're not going to repeal this unless you can get 60 votes, and as long as President Obama is in office, 67 votes, because he would veto a repeal. You're not going to, I'm being honest with you, sorry to disappoint you, you're not going to get this repealed unless you get a Republican Congress and a Republican president in the election of 2012.
The health care bill, whether reported into the Congress by a Republican or a Democrat, is unconstitutional in every way, shape, and form. There is no court solution that's available to this. You can't nibble around the edges. You must repeal it, and it must be done by an informed electorate that sends to Congress those that will do such an action. And they must be people that are well-founded in the Constitution to no longer tread on these grounds that are no longer an area that any American should ever tolerate from their House or their Senate. Thank you.
We are living today, unfortunately, in a country that thinks we have to deliver everything to it. We have Republicans across this country thinking that we have to provide health care as well. In Massachusetts, Mitt Romney has taken some hits recently because of Romney Care. Senator Bennett took a lot of heat because of his proposal to try and have the government give us health care. We have a problem in this country, and that problem is that we are expecting the government to give us everything. If we don't move back to personal responsibility, self-reliance, and get the government out of our lives, we are on a downward trend to bankruptcy. We are going to bankrupt this country. We need to send people back to Washington that have real experience in the business arena and can understand how to create jobs, because if we do not do that, we are going to live in a second-tier nation if we don't get government to downsize and free up the private sector. We've got to make a change.
One of the first steps on the way to ridding ourselves of this great evil is to refer to it not in the polite terms that it has usually been called in the media and elsewhere, but accurately as socialist progressive health care. Yeah. That is what it is.
And again, I have to say, Senator, just because they're long odds wouldn't stop me. I've taken on long odds before. And let me tell you, I would work to repeal that night and day because of that overreach of government. But I'll tell you another thing I would work just as hard on to repeal. And that's if somehow they passed this bipartisan Bennett-Wyden health care bill, because that has the same mandates that the Obamacare has. That would also be a control mechanism. None of these are health care plans. These are only going to raise the costs and prices of health care. These are government control plans that we have to continue to fight against.
Mr. Lee's a fine attorney. I've been around a little bit longer, though, and I must say that this isn't the first time that the people have been forced to purchase something. In fact, my dad was a surgeon, and he and my mother helped Ronald Reagan get started in politics with a speech to the California Medical Association about the dangers of Medicare and socialized medicine. And so I think we need a second Reagan revolution, and I think we need to start by repealing this onerous Obamacare that's been thrown down our throats, and I think that we also need to support the constitutional challenges. And by the way, I do agree with my colleague here that our senator's proposal is as bad, and I would like to replace him so we can be sure that won't pass.
If we sit here and say to ourselves, well, there's nothing wrong with health care in our country, that would be absurd, because there is. We have a problem. It's very, very expensive, okay? And there's reasons why it's expensive. I've come up with a plan on actually the way I think the health care should be maintained, operated. And it begins in the community. I've got it written up. It's out on the table. You can pick it up right there and read what I got to say about it. And I think it will actually work.